So, welcome back to Pod Talks with another fantastic episode we've got for you today. So, this is everything to do with people, organisation development. Hopefully, you've enjoyed the first few episodes. We've got another fantastic guest speaker with us today, and we'll come on to who our guest speaker is very, very shortly. However, as always, we've got our trusted lieutenant in Mr. Comedy Davies.
Wow, thank you.
How's it all going, Tom?
It's going really well. Thank you, Greg.
Excellent.
Keeping busy, doing a little bit of running at the moment, and feeling powerful, ready to rock and roll.
What have you been up to since last month?
Well, I've done lots of research for these factoids that will be coming up later, and I've started doing a small amount of jogging again, so I'm feeling
excellent,
fit and healthy.
So you're back to being fit and healthy, which is a brilliant seamless link into our wonderful guest speaker today, which is Dr. Steve Laitner. Steve, how are you today on this wonderful
I'm all right,
morning?
actually. I'm slowly waking up, helped by a bit of coffee, a bit of a run with the dog, a bit of a late night at a party last night. But yeah, no, feeling good now, thank you.
And you're looking fine, considering.
Thank you for that. Yeah.
And obviously caffeine is helping.
Caffeine is helping in an interesting conversation with you guys.
Yeah.
So yeah.
And to help sort of get that ethanol out of your system as quickly as possible.
Yeah, I've never mentioned ethanol. Just a party. You just presumed.
Just a party. I did. I made an assumption that
you
ethanol
did. There was a little
right,
bit.
Steve? Exactly.
Yeah.
Well, welcome to Steve, who's got a wonderful background, and delighted to have him here on Pod Talks. He's going to share with us some fantastic things of his background from a personal, professional perspective, and exactly what he does as a full-time professional. So we're going to get into Steve very, very shortly, but as always, as you will know at this point, we're going to go into some of our pod factoids. So Davis, back over to you. What have you got for us in this episode?
Well, I thought I'd start with something which was quite relevant really to anyone who is a manager or is being managed really. I don't know if it's stark or not, but I thought it might prompt a bit of discussion. A recent study by careerbuilder.com shows that a whopping 58% of managers said they didn't receive any management training. So if we digest that for a second, most managers in the workforce were promoted because they were good at what they did, not necessarily good at making people around them better. So
wow, that is interesting, isn't it? So we're talking almost 60% of managers go into a management position without any skills-based training or behavioural-based training. And I guess the reason they get into that role is because they've done very well in the current function, and that current function sometimes could be very, very different. Is that fair to say?
Yeah.
So, I mean, do we see that in reality in the workplace?
I think we probably do. I think you're right. I think we assume that people have management capability without knowing that for sure, without giving them training. I've managed to avoid through my career being a manager. I'm more of a sort of freelance consultant and a salary GP, which we'll come to. But I agree with you. I think I've seen people in my career who are really good at what they do, their job, really good clinically, but in terms of management capability, not always so good, and that does ripple through the organisation. And I imagine it doesn't need a lot, but just needs some guidance, and I suppose somebody, whatever level you are at an organisation, you need somebody to go to for some support in doing what you're doing, including managing other people, which is never easy.
It's never easy, you're right, Steve, and I actually think that, when it comes to managing people, it's a very complex discipline, and I think if you've managed a very successful career without managing people, I think that is an achievement in itself, because managing people sometimes it's like an add-on, isn't it? It's like an additional task that we have it over there, but we give all these minds and sort of responsibilities and purpose to one person to try and manage. It's very complex, and that could lead to things like stress because there's a lack of understanding with each other. It could lead to ill health, couldn't it, in certain respects, but also the motivation of the workforce. And I think every time you link things into people's performance, if they're happy at work or not, there's always something to do with that manager or leader in certain respects. And I think there's some statistics about people who leave jobs. They don't leave the job. 90% of people leave the job because of a manager.
Yeah.
And that's quite an interesting
And actually
statistic.
in clinical practice, I see a lot of people who come to see me as a GP with stress issues at work that is generally related to their relationship with their boss, where they feel unsupported, and a significant amount of stress, anxiety, depression, time off work, time out of work when it's then difficult to get back to work. Very common in the teaching profession, interestingly, but in all careers. And the one thing people do say is my boss just isn't supportive, isn't understanding.
Is that one of the key things you've found? Is that people feel they're not supported by their manager?
Yeah, I think they feel that they're not understood and not supported, and sometimes it's because of issues outside of work, because they're a carer or their partner is unwell, or they've got issues with their kids. And I think as a manager, I think you've got to be prepared to look outside of the workplace. And I'm sure some people are, but I think others may feel uncomfortable in, the old adage, you leave your home life at home, you go to work, but you don't. You can't leave the rest of your life somewhere.
You can try and focus on a task and remove it, put it at the back of your mind, but it's always going to be on your mind, isn't it? And it's about recognising that. And I wonder if there's a gap there with managers. Going back to your 60% facts there, Tom, is there an opportunity there for psychology, understanding and training for a manager that needs to be embedded in whatever training course for that 40% that do well as managers?
Yeah, I mean that is a really pertinent question. What Steve said before about seeing a lot of teachers is fascinating to me, from having worked in education and in school settings, and I think immediately to a time where I had the most wonderful manager I could ever imagine, and for that reason I was incredibly happy at work, although it brought with it some stress, and I do sometimes project if that situation had been different, and it would have been perhaps the most difficult and challenging time, but because that right person was in place, it was a delightful time of my life. I look back at it very fondly, I suppose. This guy didn't have any formal training. He went through straight from university to train as a teacher. He was naturally good with the people around him, and the whole team felt the same, but that was luck rather than judgment on my part, moving into a department where I knew that I'd have that. I just was very fortunate, I suppose. In terms of the training you're asking about, Graham, well, it's difficult, I think, sometimes in large organisations. I don't know if it's different between public and private, but the operation often becomes the focus, I've found, and that training sometimes plays second fiddle to making sure that you don't drop the ball in terms of doing what you're supposed to do. Again, in thinking schools, it's constant.
And I wonder with that as well, that organisations rely on people's emotional intelligence, which is a big fad word. It has been for a couple of years now, hasn't it? But it's been categorised as actually how somebody can have an emotional connection and understand somebody's non-verbal communications a bit better than somebody else, and that might give a bit of insight on how they can help that person perform and be better. Do we train that enough? It's debatable, isn't it?
And another question I'd ask, and I don't know if it's anecdotal or not, but I don't know how seriously we take learning to manage in the UK if you compare our view on kind of management training, management degrees to somewhere like Germany. I don't know, are we a country full of David Brents? It certainly rang true when you watched him in action, and I don't know anyone who's been managed and couldn't identify certain character traits that try a bit too hard to impress. I'm not sure, I haven't kind of studied that, but just certainly something
I'm sure that character comes from a number of observations, probably in this country.
That's right, which hopefully is still not around. But anyway, thank you, Tom, as always. Brilliant.
Interesting.
Great stimulus, and thank you for your time researching that. I know you've got lots more, maybe that can jump in and dovetail with other stuff we're going to go on. And what we're going to do now is lead into our guest speaker. We've got 3 standard questions that we take all our guest speakers through, and it's really interesting to hear and understand exactly, for your benefit as much as our benefit, what we can take from our guest speaker in their journey, because everybody's got something to offer and help, no matter what career journey we're on. If we're starting out, if we're mid-management, or if we're senior directors that need a little bit of coaching and a little bit more guidance, this is the platform for that. So before we get into the nitty-gritty of the 3 key questions, Steve, for the benefit of our audience, could you just tell them a little bit about you and who you are and your background and where you're from and such, and then we'll get going into the technical questions of learning a little bit more about your profession.
Okay, well, not a long story, but grew up in Sheffield, north of England, came down to
Yorkshire man.
Exactly, came down to London to go to medical school, settled here in St Albans, wife, 3 kids just round the corner from here actually, and I work as a GP, salaried GP in a local practice in St Albans, and I'm now a freelance health consultant. I've got a public health background and clinical leadership background, and I suppose I use that and the general practice to help health organisations generally around the sort of redesign of health services, trying to make them better.
And I think, and thanks for sharing that, and I think what's really interesting, if you don't mind, Steve, is really giving that differential between being a GP, so general practice, and the public health doctor.
Yeah.
How would you sort of differentiate them two roles? Because they're still equally really, really important, but I sometimes feel that people don't really see the real divide.
I suppose quite simply, public health is about the health of populations, of communities, and clinical practice about the individual in front of you. What was quite interesting for me in my career, I've been unusual, probably unusual in many ways, my wife would say, but in this regard, unusual in the fact that I was really interested in individual clinical practice, you know, the patient, diseases, diagnosis, treatment, traditional clinical stuff. But I was also really interested in sort of systems and how things work at a more of a population level, and the health of communities and prevention and screening and immunisation and all of that stuff. And where I've ended up now actually is a blending of those two things called population health management. And what population health management does is it looks at segmenting or chunking up the population into groups of people with similar needs, and how we can design services better for the different needs in the population. You know, you look at frail older people, or you look at children with disability, or people with long-term conditions, or people who are generally well who have got risk factors for future conditions. That sort of those sort of cohorts. So I've managed to maybe luckily, maybe just because I've followed my heart through life in blending those two backgrounds and finding something only in the last couple of years really that's really brought my two careers together.
And what's really interesting with that, so you've got the GP work, which is the individual there and then, trying to fix maybe that solution or get to that solution quite quick to make them better. But then on the other hand, which you're really interested in, is how can we help government, the general population, to systematically put people into these groups to then put the right solution to make sure it's a bit more proactive maybe?
Yeah, that's just the word that I was thinking of really, and generally the NHS traditionally is very reactive. Somebody has a problem and as you say you try and fix it, but actually if you look at all the groups in the population, there's a degree of proactive care that's required. Even for people who are generally well, around ensuring their vaccinations are up to date, that they've got an opportunity you know, to get some support to run a bit more, to have better family life, work life, all the things we were just saying. And I suppose in the same as management in the workplace, do you wait for your workforce to have problems, or do you actively, proactively ensure they're happy at work, they're productive, they're enjoying their work, they're following their career path, etc., etc. So.
And from a point of view of that public health piece then, where are we at as a society in the UK? Are we quite good at that, or do we need more work to improve that? Because I know you've also done a lot of work for government under that public health thing, haven't you? So you've been advising them to go down that path. Is there a lot of work there we need to do as a nation to get healthier?
I think a huge amount of work. I think, you know, you come to an area like St Albans and you see you know, a lot of people this morning will be out in the park, you know, jogging and running and playing football and the like, and you see people around here being relatively healthy. You know, you go to other parts of the country and it's not like that. You know, there aren't the healthy eating places around, there's not as good access to fresh fruit and vegetables, there's not as much green spaces, people aren't out you know, walking and jogging. So I think there's a lot of inequalities in this country, much more than, you know, Scandinavian countries. And actually, there's a lot of evidence that the more unequal a society is, the less healthy they are.
Right.
So we definitely have problems with inequalities, and we've got problems with a lot of long-term conditions through obesity, which is increasing. Smoking, although it's reduced, there's still, you know, a significant number of people smoking. levels of inactivity. A lot of older people in the population, which is great, but are we doing enough to keep them active mentally, physically, socially? So yeah, a lot of work to be done, but I think, you know, the more proactive we are and the more we look at people holistically and support them. Everybody needs support one way or another.
Yeah, well said. And picking up on the Scandinavia thing, I think it's Norway, Sweden and Denmark are the index that are the most healthiest people on planet Earth, right? And it's maybe because there's not as much inequality because they consider each other and you know, you look at their geography and you look at, they don't really have much sunlight as maybe what the UK might have from a vitamin D perspective. So you wonder how they've got that right, you know. And have you seen any comparisons there of how that's working?
Well, there's lots of interesting things. One of the one factoid, if it's okay to do a factoid as well, is that actually, in terms, we know the effect of deprivation on health. You know, the more deprived you are in terms of, you know, social status, but which relates to, you know, your chance to be smoking, obese, your likely sort of housing you're in, and all those sort of things, your income levels. We know that has an effect on health. But what's really interesting is the most important factor is relative deprivation. Okay. So if you're in an affluent area of the country, but you're in a sort of pocket of deprivation, that has a greater impact on your health.
Okay.
And I don't know whether you know of the Whitehall study, and there was a Whitehall study which looked at people's longevity, and it looked at different people in the civil service, and there was a very strong correlation between your status at work and your life expectancy, and that was put down to sort of self-efficacy and how much in control of your life you are. And
so your life would be prolonged if you were in a...
If your life would be prolonged if you're in a more senior position.
Really?
And I think they even controlled it for other factors, and a lot of it was down to how much control you have of your life and your working life. So coming back to Scandinavia, I think it's to do with social factors, particularly at work, but how equal they are as a society, and I suppose how everybody feels they've got a voice and they've got a place in society.
And a sense of purpose.
Yeah, so I think a lot of, interestingly, we always look at physical factors in relation to health, smoking, obesity, exercise, but actually psychological factors are so for example, in the older population, loneliness is as strong a risk factor for future health problems as smoking. So it may be more to do with social factors than other factors in Scandinavia.
And you
wonder.
Yeah, and you lead into a brilliant thing I wanted to quickly ask you before we go into these questions, is that mental health, right? You know, and what's going on. It's really interesting you pick up on that, because I was looking at some statistics the other day and how, if we go back 30 years ago, how smoking was a huge problem on our health and our health system, right? And now it's still there, but it's less. Whereas something like depression has overtaken from a risk factor perspective on our health. And obviously depression and anxiety, as we know, is one of the largest mental health episodes, illnesses that are currently there. Give us a bit of insight from your point of view, if you don't mind, on that, from a GP point of view, what you're experiencing about mental health. And do you see now that there's an increase in that, and if so, why? Or are you seeing that this has always been there and we're just maybe opening up to talk about mental health now?
Yeah, it's a difficult question, but I think probably it's a mixture of both. And I think it's great that people do talk more about mental health and acknowledge mental health challenges and problems. I think one of the problems in medicine and healthcare is we've tended to look at things in a sort of binary way. You know, you've either got high blood pressure or you haven't.
Right.
You've either got diabetes or you haven't. You've either got a high cholesterol level or you haven't. Whereas actually it tends to be a grey scale.
Yeah.
So what we know is, in terms of blood pressure, which is a good example, I mean, obviously you don't want too low blood pressure, but from a certain level of fairly normal blood pressure, even within the normal range, as you increase blood pressure, you increase risk of heart disease, and the same with cholesterol levels, and the same with sugar levels as well. up to a sort of arbitrary point we call diabetes, and now we've got pre-diabetes and all those things. So in terms of mental health, I think we tend to think you've either got a mental health problem or you haven't. And obviously at the extreme, that's the case. But I quite like the thinking about sort of well-being and mental well-being, whereas actually we can improve our mental health very much, even if we've not got a mental health problem.
So we've got this mental health illness, and then what you're saying is we've got mental health, poor mental health or positive mental health.
I think we've probably got a lot of grey scales in between.
Yeah.
So where we draw a boundary between normal mental health and mental illness, where we say somebody is clinically depressed or has depression, is quite a grey area. So I think all of us have challenges in our life. As my eldest daughter says, life is hard, and people are complex.
Yes.
So I think maybe what we should do a little bit more of is, rather than saying we've got these people with mental illness, we've got these people who are fine, isn't it to a large extent, in a public health way, about improving the mental well-being of everybody?
Right, and isn't this the interesting thing, back to your point on public mental health, and I totally associate and get what you're saying there, because sometimes when we talk about mental health, there's still that taboo, there's still that stigma, and it's because we're focusing in on have we got the mental health illness or not, and we're still trying to expose that and discuss that, but actually we can forget people who have got positive mental health, and the idea is to maintain that and keep doing it, rather than just focusing on somebody with poor mental health, for example.
There was a very good epidemiologist, public health doctor, who actually was a cardiologist, a chap called Geoffrey Rose, who wrote a book called The Prevention Paradox. So he showed you've got a normal distribution of cholesterol level, and in terms of public policy, you could either screen and focus on the people at particularly high cholesterol level and bring them down, or through population health approaches, you can shift the whole curve slightly to the left. So you reduce ever so slightly the cholesterol level of everybody by, I suppose, taxing fatty food, or by fiscal policies and other educational policies.
Such as the new sugar tax.
Exactly, and you could say the same about alcohol and alcohol tax, and whatever we do for mental well-being, whether it's about workplace management skills, for an example. And actually, if you could improve the mental well-being of everybody just a little bit, it will probably have a bigger impact overall than just picking up people at the end of the spectrum.
Absolutely, because then there's, like the Scandinavians do, it's a journey together, isn't it? And everybody's supporting everybody in general terms, and I think there's a lot to be said in that. We were speaking the other day about this, is how we must consider thy neighbour. That's what we must do, surely. And I think we've probably lost that a little bit in modern times, and maybe we can get to that point again when we start considering each other.
We had that nice time, didn't we, the other week outside your flat?
Yes.
And somebody I used to work with walked past, and she came and had a chat with us, and Gracie brought some tea from inside, and there was some other people there. And that was just lovely, wasn't it? Yeah. Literally sitting on the steps of a house with people from the road, having a cup of tea. I mean, it doesn't get lovelier than that. And I think we forget how social beings humans are, and how we absolutely need that connectivity, literally, with our neighbours.
Absolutely.
And that's, I think, maybe that's what Scandinavia has more than we do.
Absolutely. And you look at the mega cities now going on in the world, in particular, let's take London, what's about 11 million population now. So it went up to 12, it's gone back down. It's the loneliest city in the world. Right? But you're so surrounded by people, but then the issue comes that nobody's communicating, and you're right, we're designed to socialise, aren't we, and be together. But I wonder, is that an output of capitalism or what? It's a very interesting.
I mean, I found that in London, they're moving to St Albans, quite different, but in a very, very positive way. And it makes you feel much happier if you say hi to your neighbour, and even if you don't say very much after that, you're still connected.
You're connected. And I'll give you a quick example. When I moved to London to work there, I went on the tube, obviously being from the north of England, being very friendly, got on the tube, and I looked at everybody's there, they were reading the papers, and I went, "Good morning," stood at the door, people stuck their head up, looked at me, you wouldn't believe it, put their head back down, all stood up and moved to the end of the corridor. And I stood on my own. It was only 2 tube stops, but I thought to myself, okay, note to self, don't speak to anybody on the tube again. But actually, you know, it needed that communication, you know,
and people are starting that a little bit now, aren't they, on the tube?
But it was interesting, their perception of me, they seemed saw that I was going to be a threat, because I naturally did what we were supposed to do, is connect and communicate.
That's another bloody northern.
Yeah, the northerners invaded the south again, get him out, quick, don't talk to him, then he won't come back.
Excellent.
But fascinating stuff, Steve, thank you, and we'll keep going with this and we'll keep moving on. So let's get into our first of 3 questions from a technical point of view, and I think this is quite a strong one before we get into the second question, where we're going to delve deeper into what we've been talking in your work. But I think for our audience, the variety of people that are listening to us, we've got obviously people who are seeking employment from the age of 18 right through to chief execs of organisations. And no doubt they'll be listening to this and thinking, this guy's got a lot of interesting things to say because of your GP and your public health stuff, and you know, we could talk a lot all day about that. But from your perspective on where you're at, thinking back to how you started out, what's been your personal and professional career highlights? What are them things, be it 1 or 2, professionally, that you thought, yeah, I'm really proud of that, I achieved something there for what I do in my discipline, and also personally for you, what's been the personal highlights from them professional career highlights, if that makes sense?
So, I mean, one of the examples I always come to when people say, you know, a similar question, you know, what's a highlight, what's a professional highlight? I started as a GP in St Albans in the late 90s, and at that time, and still in a lot of general practices in this country, it's a traditional model of the patient rings up or comes in and they want an appointment, and they're told there's one, you know, a few days or even weeks ahead, and then there's a bit of bartering because the patient's suggestion to the receptionist is quite urgent and they'd really like to be seen that day.
I remember those.
And they may be seen that day, or they might not be seen that day, or they might be told to ring again the next day. And I saw this and I thought, well, this really isn't very good. You know, we're going to miss people with acute illnesses that really need seeing that day, and other people will sort of stoically see somebody in 3 weeks' time when actually they really needed to see somebody much sooner. And then I did out of hours work, you know, GP out of hours. And the model there was whether the practice did it their own or they went into what was then a co-op. You know, you always spoke to the patient first. You had a conversation on the phone, and then you worked out, you know, do they need to be visited at home? Do you need to see them there or then? Could it wait a day or 2? Or sometimes you gave some advice and reassurance on the phone, and that worked. So then I decided actually it would be a really good idea if we did that in the practice routinely. We spoke to people before we gave them an appointment to see if they needed to be seen or wanted to be seen, when they needed to be seen, by who, for how long, with what sort of preparation. So over a few years, trying to persuade the practice by myself, which didn't work so well because I was a junior person and a salaried doctor, not a partner. And then I got a local partner on side, and 15 years later, well, it was a few years after that, a couple of years, but now probably 20 years on, that's embedded system in our practice. That if you're a patient with our practice, you ring between 8:30 and 6:30, you get put on the doctor phone back list. If you've got a new health concern, we speak to people sometimes within minutes, sometimes it's an hour or so, depending on the sort of number of calls, and then we deal with a lot of problems on the phone, or we arrange to see somebody that day if they need to be seen or they still want to be seen after the call. And a lot of practices are doing that now across the country, and some moving to sort of digital access, digital triage as well. So I was proud about that because it was a passion I had. It was hard to get people to change, you know. A number of doctors said, well, the patients always want to see me. I said, well, maybe they don't always want to see you. Or I always want to see them. I don't like talking on the phone. And a lot of challenges, personal, professional challenges, but now it's there. It's a system that is helping our 20,000 practice population. So I'm really pleased with that.
That's an amazing achievement, and that's quite pioneering as well, isn't it? And as you were speaking there, I mean, personally, I'm the same, you know. the amount of conflicts and frustrations that went between the patient, reception,
Yeah.
and then the doctor wasn't really promoting a really good practice of coming to a GP or a hospital. And I, for one, really do not like going to receptionists because I think it's quite private and we trust that relationship with the GP more, don't we? So that's interesting, you put that in place. But also, from what you were saying, I was thinking to myself, well, how did you get through that? You know, because that's tough. If you're a change agent and you're driving something that you believe, what was your beliefs? Why is it you wanted to get to that point? Was it just because you had all this energy and vibrancy and you wanted to prove a point, or was it because you were thinking this is a better way of how we can help people who need recovery?
So I think, and I've got a diagram I could share with you another time, I think, and it sort of links into my different backgrounds. So, you know, I've got this background as a GP, this background as a public health doctor which looks at systems, and if you think about sort of Venn diagram, they're overlapping. And then the third one that overlaps is my experience as a patient and a carer.
Okay.
So, you know, I've got 3 long-term conditions. They're quite well managed, don't really affect my life particularly. Form of arthritis and asthma and psoriasis and stuff like that. But, you know, that's fine, but I've got a bit of insight as a patient. My oldest daughter, as you know, has a learning disability. You know, I was involved obviously as a parent, but also medical advice when my dad was ill and died about 6 years ago now, my mother-in-law. So I think I've had quite a lot of insights sort of as a patient and carer. And what I've got comfortable with doing fairly recently in the last few years is bringing all those 3 together. So I think why I'm unusual as a GP is that I very much bring the population and the patient perspective to the table.
Yeah.
So, and I get really, to be honest, I get quite frustrated with some of my clinical colleagues where their viewpoint is the doctor, and, you know, we have all these worried well people calling us and they don't really need to call us, and I think, who are you to say that they don't need to call us? They're not calling us because it's fun. They're calling us because they've got a concern. You might not understand it because of your medical knowledge and everything, but they've got a concern. Just speak to them and help them.
So you're actually picking up on empathy as a soft skill, maybe because of your experiences, but also, you know, maybe that's inherent in you, is to look at it from the perspective of the patient. In my world, I would say looking at it from the perspective of the customer.
Exactly.
And that's quite an interesting mindset, isn't it? Because not everybody's in that situation. In particular, when people technically get trained and very good, they do put themselves in an egotistic world, maybe, of I've got all this training, I've got all this knowledge, now I'm going to be the oracle of this. But it's just not true, is it?
No, and I think humans, actually, I've thought about this quite a lot, and I think humans generally find it quite hard to view the world or a situation through somebody else's eyes.
Right.
And I think in a way that's one of our major challenges as a species. You know, we need to do that, and maybe, you know, no other species do it because they don't need to, and they need to sort of fight for survival and all of that stuff. But I think as human beings, to live in a very social world that we do have to view a situation and the world through other people's eyes sometimes. And I think we need to be better at doing that, whether you're a manager to understand the view of the person you're managing, but also as a professional, a clinician, a doctor, whatever. I think helping people to have empathy is one thing, maybe hiring and firing accordingly and all of that stuff. But also I'm a big advocate for patient leadership. So I've got a few friends and colleagues who are in senior positions in the NHS through their lived experience as a patient and their skills at being able to bring the patient voice to the table in the design of services and getting feedback and the like. So I think you should always have in healthcare a clinical leader, a managerial leader and a patient leader. And I talk about those as a sort of holy trinity of leadership in the NHS.
And love that thought without getting into leadership too much, but just one thing to pick up on there is that leadership I see now is a circle with the leader in the middle, always looking out, rather than the leader being somebody who's looking ahead with a vision of people behind them. And they've got peripheral vision then, and therefore what lenses are they wearing? And it's interesting with empathy, isn't it? Because, you know, we are naturally as a species, we judge because it's a safety mechanism, but actually being non-judgmental is quite a skill to do, to be able to put ourselves in the shoes of somebody else, to be able to empathise. And that's what we call a frame of reference, our window on the world, which will be very different all the time depending on our upbringings, our experiences. So it's really interesting to try and challenge one to help people understand they've got to understand. But I think if you've got it, and exactly the example you're talking about, I feel very reassured, Steve, that I know there's somebody in the medical profession who's thinking like that.
Yeah.
Right? It's fascinating, isn't it? Because you sometimes do wonder, like any profession, who's driving this to make it better, or who's just sitting back and accepting that it's just what it is. And one of the frustrating things is that we've all got insight and input these days, haven't we? So I want to be able to have my say. And being enabling people to do that, in your case, the leader of the patients, who's considering their input and how they want things to be. And I find it quite interesting now, in particular with doctors, how they've got the digital platforms, aren't they, where you can log in and see a doctor over Skype and things like that. And that's patient-led, isn't it? You could argue, which is phenomenal. And be interested to see the statistics.
Yeah, and I think it's taken some of that to get more and more doctors to appreciate that they do need to change.
Yeah.
It's taken an external sort of private provider to get people to change, sort of disruptive innovation and the like.
Yeah, that word disruptive. Excellent. I'm gonna pass you on to Tom to move on to our next question, because that is such an interesting
It was fascinating
insight.
looking at an area of what you're doing that impacts on virtually everyone at some point in their lives, and it's certainly developing, and going to my experience of it, it's certainly improved in the time I've been using the services, so thank you for that. I want to bring it forward a bit, I suppose, now. I have revisited the Living Life Better website, and again I've been through the process, which I think is available
You've
to anyone.
taken the test, have you, Tom?
I've taken the test twice, because I know one of your business partners, Simon, was here previously, and since the last pod talks I've ticked up by 2%, so I don't know if that's good. I'm now at 67%.
You see, we're helping you live life better already.
I'm living life 2% more effective.
Yeah, incremental changes.
It might be the jogging, so maybe a marginal gain. But I'd be really interested to hear about what you are doing right now, whether it be Living Life Better or other aspects of your practice, and what you hope to achieve from kind of this point in time looking forward. For a bit.
So Living Life Better is a new venture in St Albans, myself and two clinical colleagues, myself as a GP, another GP from a practice, actually the partner who helped me bring telephone triage into operation, Richard, so he's excellent, and Simon, who has been interviewed by you guys before, who is a physiotherapist by background, a health coach, and has got a lot of experience in the corporate world, helping individuals and organisations perform better and live better. So the three of us, we've got a room at the Temple Clinic on London Road, just up from the Odyssey on the other side of the road. We've got a web platform, livinglifebetter.uk, and essentially we're here to help people as a person, as an individual, but also in organisations as well, to live life a bit better. You know, if they've got a challenge to overcome, if they've got an ambition they want to achieve, we'll sit down with them for an hour. You know, we'll get to know them as a person, what matters to them, what makes them tick, what challenges they've got, what they want to achieve. And it's really a push against the traditional silos of physical health, mental health, social health. We see the person as a whole, and we help them as a whole develop a plan for how they're going to live life a bit better. It might be about health, it might be about well-being, it might be about success. Often it's about all of those things, because we're complex beings and we need that balance of all of those things in our life. No wonder it's hard to get it right. And we sit down with them, we develop a plan of action with them, their plan, and we use the amazing network of expertise in the St Albans community, people who help with relationship counselling, with swimming, running, Pilates, yoga, nutrition. We've got a team of people who we signpost people to, but we're the golden thread that bring that all together and help people on their improvement journey. And it's great. The challenges we've got at the moment is getting enough people to know about us. But we're here to help and support people to live life better. We do cover health, but we also cover well-being, and we also cover success. And we don't only support individuals, we support local businesses too.
Which I think, as we've said before, the product is amazing, and it encapsulates everything you need from that whole well-being thing. So it's going to be really interesting to see. I think it's going to be a huge success, but you're right, it's like anything, isn't it? When it's how do we get that out there, and how do we get it marketed, and what different platforms can we do that with? But certainly
it's quite a hard thing to describe. Sorry to interrupt. I was just in my mind and making sure I didn't forget anything. I've not had quite enough coffee, but I think it's quite a difficult thing to explain, because people are used to some things. Either you've either got a private GP clinic, or you've got a sort of wellness centre, or you've got coaching, and rarely do you try and bring all those things together. So that's why I think it can be hard for people to get what we do, because we sort of do everything in a very blended way, and I think that's quite unusual.
And I also think that, having seen how it operates, is that it's one of them things that when people do it, they'll be blown away with the methodologies you're using and the outcomes you're going to get. So it's how, that's going to take time, obviously, with people to go through that process, but also how do you show and demonstrate that to people who have never come across that before? And that's then that sort of step, isn't it, change to get to that point. But certainly worth having a look at that website, Living Life Better, as well, which is wonderful, and I think it's going to be huge. And I can see that, in particular as well, the positioning where we are in the UK, in particular close to London, and people who are working in these environments where they need a release. And most times it's do it yourself now, isn't it? People do it yourself. I'll learn a little bit about running or exercise. I'll learn a little bit about nutrition, and but that's always evolving. So how do we really get that into a report to understand what's good for me? How's it going to work for me, type thing?
And I've thought quite a bit about this lately, and I think we tend to have quite a sort of siloed approach to addressing, what we traditionally call risk factors, inactivity or smoking. Whereas generally, it's not a single issue, is it? It's about maybe exercising a bit more, eating a bit more healthily, drinking a bit less, spending a bit more time at home, maybe, a bit more time talking with the family. He said there's quite a few things, and you can't just do a running app and everything's sorted. And I don't think you can do everything yourself, particularly when it comes to life. It's too complex.
And I think a great start for me has always been the 5 ways to wellbeing.
Right.
From the point of view, from an NHS perspective, I think that's been a brilliant barometer. And when you look at that individually, it's really hard to pin down exactly how it's going to work for you. So obviously, Living Life Better, it gives you a bit more data, it gives you a bit more professionalism, obviously from the medical backgrounds that you guys have got, and then obviously that can give a real platform, which I think we can see coaching's working now for the mind, but actually it's putting that mind and body together, isn't it? Which I think is excellent. I think you explained it really well, by the way.
Oh, thank you.
I thought it made sense.
I keep practicing.
Yeah, I thought it was good. I thought it was good. We'll have to have a word with Simon though, right?
Trying to make things simple is always a challenge in life.
Well, it is. Yeah, exactly. The hardest thing to do is simplify, isn't it? Which is there. Okay, we're gonna pass on to Tom in a minute about our little fun game of Beat the Griff, where me and you are going to go up against each other and see.
I'm not feeling good about this.
I'm equally not feeling good, so I don't know what that says about both of us. But just quickly before we go on to that, I just wanted to get your input and insight, which I think is really, hopefully, an interesting question for the audience. Is that if you were going into the workplace today, in today's world, with what's going on around us, so that 18, 20, 22-year-old, or if you are a CEO today, which you're not far off from your other stuff that you're doing as well, what is the sort of skills that you'd recommend to the CEO out there today, and obviously that young person coming into the workplace? What sort of skills do you think is a must they must have to succeed? And obviously at this point, consider your background as well. When you were that 18, 20, 22-year-old, what skills did you have then? Do you still need them skills, or is there a new skill that people have to require? And has there been any change and such?
I suppose when I was, let's say 18 and starting medical school, coming down to a place you don't say hi to everybody on the tube. I probably learned that lesson early on as well. I think, then I assumed I was going to have a very traditional career. I was going to, go through medical school, and probably I thought I was going to be a hospital doctor, I think, and I probably thought that for quite some time. And then I allowed myself, even though, other people might have suggested I carry on down a more traditional approach, family members and the like, I sort of followed my heart and, did the hospital medicine, then did a bit of general practice, then got on this public health training scheme. And I just sort of followed my passion and my interests and where I thought I could make a difference in a very non-traditional way. And I see that more and more now as people come through their career paths, that it's not a straight trajectory, that at 18 what you're going to do and you're just going to go on a straight path to there. So I suppose looking back, I'm quite proud of myself that I was able to veer off and follow the path that only probably in the last few years, I'm 52 now. 51, 52, so old I forget. somewhere over 50 anyway. And I've only recently found I've sort of got my niche now. So I think I'd say to my younger self and to others, 18, 20, don't be impatient. It's a long journey, and I think even nowadays, particularly, people I don't think they see they've got a single career for life.
Yeah.
And I think that's quite a good thing, actually, that people can flow. And I suppose you just need to build up lots and lots of experience and a variety of experience. And I suppose so long as you're earning enough money and as long as you're doing what you enjoy and love, and I think that's crucial, then I think flowing through the system, you'll probably get to the right place in the end.
I really enjoy what you're saying there, because it was a similar path for me. I wanted to do well for myself, but I never knew what that was going to be. So I just set off on a journey of, well, I like this, I like that, let's see where it goes, put the best into things and see what happens. Yeah. And that's really interesting to have that mentality, isn't it, rather than putting yourself under pressure to say, right, I need to be here by such and such a point, but also how to be, to use patience as a key skill, I guess, as in, not to be impatient to try and get somewhere so fast. Allow the journey to take you, and in particular the experiences. That's incredible, isn't it? Be it volunteering work or internships, or if you're at that younger end. How about the CEO that's out there in business now? Then let's say they've got all these thousands of people, if not hundreds or just tens of people. What would you be advising from your experience, and also maybe with your medical hat on, what would you be saying to CEOs in today's world to get the best out of their people?
Well, I like your model of the leader being in the middle, looking around them. I hadn't heard that before,
right?
But I really like that, and I think that's important. That the CEO is, as well as looking forward for the business, is looking around them and their team and their workforce. I've always been impressed by leaders of an organisation who have, walked the floor and chatted to people and see what they're doing. I think there's nothing like connecting, not just with your senior management team, but the workplace more generally. And so I think being seen, listening, not just talking, but listening, and not just with your directors. And I think, I don't know this for sure because I've not been a CEO, but I think giving some of yourself, I think we maybe too much compartmentalise our life. And we talk, don't we, about work-life balance. But the more I talk to people, the balance can go both ways. And I think, so for some people, they might, be happier spending a little bit more time at work. We always assume what direction the travel has to be. I suppose I've come to a stage where I see a bit of a blurring between my work and my life. So I don't see it as two different bits of my life. I see it that I've got a life and I'm a person. I've become more and more confident generally in talking about my general life, my personal life, my family, you know, when I'm at work, and I think more and more people do so, and I think that's a good thing. I think what I'm trying to say is that for CEOs to show more of themselves.
Wow.
I think.
And just to come in on that as well, and I think two things from what you're saying is that, you know, maybe it's because when you feel you've got that, not that term of work life, but you feel you've one life, maybe that means your well-being's in a good place first and foremost. I certainly feel that as well, and I haven't always felt that, which is quite interesting. And the second thing is, isn't it amazing to be vulnerable now and again, right? And you know, from a leadership point of view, we sometimes create this image and this being, and most times it's not us.
No.
Because it's learned behaviour to act in a certain way because we think that's the right output. So we then have to worry about, you know, what is our acute stress to chronic stressors, because can we be ourselves or have we become this other person? So actually being able to show vulnerability to connect to others for the CEO and their staff members brings people together, which makes a happier workforce and a more productive workforce, doesn't it?
Yeah, I think you'll be seen as more approachable.
Yeah.
And maybe sometimes people do that because they don't want to be too approachable. They
Right.
think they need to spend all the time, you know, on emails and the like.
Or being a distance from staff,
Exactly,
because sometimes some people think that that's the right thing to do.
Yeah, exactly.
And is it? Is the big question, isn't it? Fantastic, Steve. I wish we could have hours. I really do. 'Cause it's phenomenal talking to you.
Good to talk.
Yeah. So I think Tom's itching to get into being grit. So shall we have a bit of fun and see where we go? And by the way, just to straight state, I know nothing about Tom's preparation or questions here. But what's the scores on the door so far, Tom?
Well, Graham, after the last round of Beat the Griff, you won 1.
Yes.
You lost 2.
Oh.
And you drew 1. So
Drew 1.
you've got a little bit of ground to make up.
I drew 1 with Simon. No pressure, Steve.
No.
So we go.
You're playing those mind games now, aren't you?
Trying to get myself, get that extra
Get that
inch of
edge.
opportunity to try and win.
We'll alternate the questions.
Okay.
Okay. And you'll each get 3 questions.
Right.
So we'll start.
Who's going first?
We'll start with. Well, Graham, since you've got a bit of ground to make up, it might be an advantage for you to go first.
All
So
right, here we go.
Any advantage I can. We've
Come
got
on,
the answer
Steve.
on the difficulty of the questions. I have to say that as well. So they are tough. I might tell you where I drew them from later, but not now because
Hit
it might wrong foot you. You ready?
Yeah.
Psyched.
Go for it. Yeah.
Okay.
Psyched. Done.
The multiple choice as well, so don't jump in
Oh,
because that could
fine.
make things awkward. Which county cricket side is based at Chester Street? Is it A, Warwickshire, B, Durham, C, Northants, or D, Leicestershire?
It is B, Durham.
Wow. Griff, that's a point to you.
Yes.
Woohoo! I'm pleased I didn't get that question.
Really?
I hope they're not all sport.
No, they're not. It's a good mix, I feel. Okay. Steve, which monarch was known as the wisest fool in Christendom? Is it A, James I, B, Charles I, C, Edward I, or D, Henry I?
Ooh, choices.
The wisest fool in Christendom. Gosh. I think I'm going to go with James the First.
1-1 done.
Whoa,
That's
wow.
a great get, that
Was
one.
that a guess or did you really
Oh
know that?
no, I don't. I know all about James the First.
Solid answer.
Yes.
Excellent.
Okay.
Right, Graham. Which king was married to Eleanor of Aquitaine? Is it A,
Oh.
Henry I, B, Henry II, C, Richard I, or D, Henry V?
Oh man, I haven't got a clue. Say the question again. What was the question again?
Okay, which king was married to Eleanor of Aquitaine? Is it A, Henry I, B, Henry II, C, Richard I, or D, Henry V?
I'm going to go with C, Richard.
Okay, that's a good answer.
Not
Let
gonna
me- Well, I'm going to tell you in just a moment.
Oh, okay. This is where the wonderful Google comes in, is it?
No, you talk like I don't know the answer to these questions myself, which...
Do you? I thought you knew this. Oh, right. There's been a bit of a. You've been a bit sort of stumped by my correct answer. I think. Is that what it is? Eleanor of Aquitaine is.
Well, interestingly,
I'm correct.
She married to all of them.
Ooh. It's that time of year, isn't it? That everything was going on. Who knows who was doing
Henry II. So what did you say?
Yes, I agree.
I don't think you got that. No, you didn't say
I didn't. I went with Richard.
So you get no
I lost that
points.
one.
Don't panic, there won't be one of these each time because the answers are on the rest of them.
Okay, good to know you knew the answer.
Super. Right. This is going better than last time. Steve.
Okay.
Oberon is the satellite of which planet? A. Mercury, B. Neptune, C. Uranus, or D. Mars?
Mercury, Uranus, Neptune, or Mars?
Yeah.
I'm going Neptune.
It's not Neptune, it's Uranus, I'm afraid.
I was
So
thinking Uranus as well. I don't know why that came up.
that's 1-1.
It's 1-1. Final
Okay.
question
Final
each.
question, go on.
I love
Scary
Steve.
stuff.
Here we go.
Right,
Let's see if we can get a winner.
great. In 1912, former US President Theodore Roosevelt was a candidate for which political party?
Oh, okay. So he was. I'm going to go.
Oh, I think
Would you
you've
like
got
the
your
options?
Oh right. All right. Sorry. Yes, I forgot his multiple
A.
choice.
Bull moose, B. Bulldog, C. Bull elephant, or D. Bullfrog?
What?
Was it A. Bull moose, B. Bulldog,
Somebody's
C.
mixed his
Bull
questions
elephant, D. Bullfrog?
I thought he was either Republican or Democrat. I thought that was where the question was going. It's potluck. A.
Bull moose.
Yeah.
That's correct. Well done.
Oh!
So it's 2-1 to you, Graham.
That is love.
Steve's got
Jammy Dodger.
one question left. Okay, I hope I'm getting pronunciation right here, Steve. Thomas Masaryk was the president of which country? A. Czechoslovakia, B. Poland, C. Hungary, or D. Yugoslavia?
Remind me the name again?
Thomas Masaryk.
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 Czechoslovakia, Poland, Hungary, Yugoslavia.
Mm-hmm.
We go with Hungary.
It's not Hungary, it's
No.
Czechoslovakia.
I would have gone Hungary as well. That's fine.
Graham,
Yes!
you managed to...
Congratulations,
Well done,
Steve.
Graham. Well done, Graham.
That's a good game. And so you are in the picture on the level of difficulty of those questions. They were all £1 million questions from Who Wants to Be a Millionaire.
Really?
So they were as tough
Oh,
as it gets
really?
on that game show.
Get me on it.
Get you on it.
They were tough, weren't they?
They were tough.
They were tough.
I love mine and Steve's sort of like intent.
I know.
Say it again,
I know.
say it again. That competitiveness.
Yeah.
Is brilliant.
Even though I had no idea what the answer was.
It was very fluky for me on that second one. But thank you, Steve. Superb. We're coming to the end now, and whilst I give you guys a bit of thought to just reflect on our conversation today and wrap things up, just to thank the audience again and to make you aware that please subscribe to Pod Talks on our YouTube channel. So just go to YouTube, make sure you've got a YouTube account, it's free. Click into Pod Talks and then click on subscribe. Give us some comments and feedback on what you found today. The idea of what we want to try and achieve after our 12 episodes of Series 1, we want to make sure that we can try and get some feedback and do a live audience and pull back our guest speakers in whatever capacity. So certainly give us your feedback. This is for you. Hopefully it's been really, really useful in whatever we do in life. You can hopefully pick some things out, but also if in your work life as well to help your performance and such. So bit of a takeaway then to wrap up, Steve. What's really been in your mind and reflection of what we spoke about over the last 55 minutes, and what do you want the audience to take away from our conversation here today?
I think it's been a great chat. I really enjoyed it, found it really interesting. And I suppose that's probably my take-home message, you know. Life can be hard, you know, people are complex, but it's great, isn't it? Isn't life and all aspects of it fascinating? And I think you only really appreciate how fascinating it is by talking. So keep talking.
Wow, superb. And diversity, isn't it? You know, we're all different. Isn't that brilliant? That we've just got all this diversity going on and difference. And thank you to you, you know, as a public health doctor, but a GP, and your drive to do things for people. You know, I've always been fascinated in people who work in the medical world and how they help us as individuals, and that passion to want to, you know, help people in a crisis situation. So thank you to you and how you've been driving it, and having spent some time working with you as well. You know, it's amazing what you do and how you do it, particularly that public health piece. I think that's incredible. thank you for your time. We'd love to have you
Pleasure.
back again on Pod Talks. We'll see what that looks like, and good luck with the whole Living Life Better stuff. Davies, to wrap up from your perspective.
It's a heartfelt thanks for me as well, from me to Steve for giving his time to us today. I think it's been really enlightening, and just to revisit livinglifebetter.uk, slightly unusual address there, that people can go to that site at any time, no obligation,
They can take
test
a
that they
test,
can do
yeah.
and see how they're faring. It's just a good chance to perhaps reflect on where they are in certain aspects. But yeah, a huge thank you. It's been great. We hope to see you again. Thank you.
Thank you. So until next time, thank you to Dr. Steve Laitner and to our wonderful comedy Davies, and we'll see you soon. Thank you.
See you later.